You should know the proper way to care for a gastrostomy tube. This video will review how to clean the gastrostomy tube site. Then we will show the steps for feeding with both a high profile and a low profile tube. For this procedure, you will need feeding, spandex, warm soapy water, cotton tipped applicators, soft wick gauze, a 30 or 60 milliliter catheter tipped syringe, Lurlock syringes, bottled water, club soda, and a feeding pump and feeding bags for continuous feeds. Before you begin the procedure, clean your work surface. Then, properly wash and dry your hands. If the child is old enough, inform them that it's time to clean the tube. Hospital staff should always don clean gloves for this procedure. At home, gloves are not required. Clean the gastrostomy tube stoma daily and as needed. If bolsters or sutures are out, patients should be bathed, immersed at least once, and then clean the site as needed when there is crusting or drainage. To clean a gastrostomy tube site, start by gently lifting the plastic ring if it's a high-profile tube, and then clean around the site with water and the cotton-tipped applicators or gauze. Now, rinse off the soapy water. Next, dry the stoma, making certain not to use any creams or ointments. If the site is weeping, clean with half-strength hydrogen peroxide. Initially, gauze may be used for a few days with a new stoma, but do not dress healthy stoma with gauze. Note any odor, discharge, or skin irritation and report it to the doctor. Apply a clean soft wick dressing if one was used. If gauze is used, you should remove this dressing frequently if it gets wet or soiled with secretions. Stabilize the gastrostomy tube with spandex. Double over with no hole in it, as it is not stabilizing with a hole in it. This helps prevent trauma and leakage. If you see any redness, pus, smell a foul smell, or see sensitivity when the area is touched, or the child has a fever, these may be signs of an infection. If your child has a high-profile tube like the one seen here, begin by uncovering the tube and pinch before opening the clamp. Attach 60 milliliter catheter tip syringe to the feeding port without a plunger. Unclamp the tube by letting go and allow air to escape. Food may also escape and allow it to drain back into the stomach. Pour feeding into the syringe and allow the fluid to go down by gravity. You can use a plunger to give it a slight push to help it start to go down. Pinch the tube to clamp it. Flush the tube with club soda to clear any feed or medication. The amount of water is usually determined by the child's size and length of tube, so follow the doctor's orders. Close the feeding port. Cover tube with spandex and secure. When using a low-profile tube for feeding, start by uncovering your baby by moving the spandex down. Use a right angle feeding tube. Open the button and attach the extension and a line. Then lock it to the right. Remove the plunger from a 60 milliliter catheter tip syringe and attach the open syringe to the end of the extension tubing. Release the clamp and allow air to escape. Food may also escape and allow to slowly drain back to the stomach. Pour feeding in and allow to go in by gravity. Once the feeding is done, clamp the tube. Disconnect the syringe. Attach the club soda for flushing. And unclamp the tube. Now, flush the tube with water to clear any feed or medication. The amount of water is usually determined by your child's size and the length of the tube, so follow doctor's orders. Clamp the tube again. Disconnect the feeding extension and close the button. Replace the spandex and secure. If the gastrostomy tube becomes dislodged, prepare a spare tube by lubricating it with a water-soluble lubricant. Insert the lubricated tube. Do not inflate the balloon. Cover with the spandex to keep stabilized and in place. Consult a doctor or visit the ER before using the newly replaced tube, as an X-ray may be needed to confirm placement. Remember, stomas close very quickly. Here are some tips you need to know. If your child has a high-profile tube, keep it stabilized under the spandex when you are not feeding. Do not let it hang. If your child has a low-profile tube, don't leave the extension tube attached unless you are feeding, flushing, or venting the tube. Keep the button closed when not in use. Call your healthcare provider if the site is red, leaking, swollen, sore, or has excess skin. When at home, your child can go into the ocean or the pool. Don't touch the balloon port in a brand new gastrostomy tube. Do not mix medications with formula. After you administer medication and after you feed your child, do a water flush. If your child is on continuous feeds, flushing should be done every 4 hours. Flush with club soda after meds. 1 flush of regular water, followed by 1 flush of club soda. If your child does not take medications, a club soda flush must be done daily. At home, wash extension set with soap and water and rinse thoroughly. Do not place extension tubes in the dishwasher. Instead, hand wash them with dishwashing liquid and allow to air dry. Rinse extension tubes once a week in a half soapy water and half white vinegar bath for 30 minutes. Then rinse with warm water and allow to dry. Your nurse will review this procedure with you, but practice it in order to become more familiar with the process.